Hello, everybody. I'm Dr. Islam Abdurrahim. I will be giving this lecture in the occlusion course, and the topic of this lecture is neuromuscular function and its interaction with occlusion. This is a very wise statement from an occlusion specialist or someone who really know occlusion very well. He said, you cannot successfully treat this function unless you understand function. So as a dentist, if we face a clinical case or a patient with dysfunction or problem in functioning in a proper way, we can never treat this condition unless we understand what is the normal. Okay? So today in our lecture, we'll be talking about the anatomy and function of the neuromuscular system, and we're mainly going to talk about the neurological structures, which include the neurons, the sensory receptors, the brainstem, and the brain. Then we're going to talk about the muscles, what is the motor unit, and what is the muscle sensory receptors, neuromuscular function, how the function of the sensory receptors affect the response from the brain and how the reflex action happen. And then we're going to talk about the major functions of the masticatory system, which are mastication, swallowing, and speech. So as we said before, to be able to treat any abnormal condition, you have to understand what is the normal and how the normal actions happen. So that's why we're going to talk about the neurons and muscles and how both of them coordinates to get us the right tooth contacts and how all of these affects the mandibular movement. So, as a refresh of what we know about the neurons, we all know that it's the basic structural unit of the nervous system, and the neuron is composed of the nerve cell body and then the process, which include the dendrites and the axons. And as you know, the nerve cell body is located in the spinal cord, specifically in the gray matter or gray substance of the central nervous system. And if the cell bodies are found outside the CNS, then they are grouped in something we call it ganglia. The axon is the central core that forms the essential conducting part of a neuron, and it's an extension of a cytoplasm from a nerve cell. So we all know that the neurons have a very long axon, and this axon is how the signals transmit from the peripheries to the center. Now, many neurons are grouped together to form a nerve fiber. So the nerve fiber composed of many number of neurons. So neurons are the structure in the body who is responsible for moving the signal, electrical and chemical impulses along their path from the peripheries to the CNS and from the CNS to the peripheries. And according to that, we have two main types of a neuron. There's the afferent neuron and the efferent neuron. And when we say afferent, we mean this neuron conducts the nervous impulse toward the CNS, while the efferent neurons conduct it peripherally from the CNS to other structure in the body. The second important structure in the neurological structures is the sensory receptors. So these receptors are like very sensitive receptors located in all the peripheries in the body, and their role is to feel what's going on and tell the brain this is what's going on. Okay, so we have different types of receptors. Some of them are specialized to feel the warmth, the cold, the pressure, the light touch, and we call them exoreceptors. and others are responsible to feel the discomfort and pain, and we call them nociceptor. Okay, now the exeroceptor, if we say warmth, they have names. Okay, so when we say the receptors responsible to feel warmth are Ruffini corpuscles, the pressures is the Pacinian corpuscles, and for cold it's Croce corpuscles, for light touch it's Merkel ending and Mesner corpuscles. And this is a diagram showing the different types of exeroceptors found in the body. Um, So here's a diagram showing the several types of the exeroceptors. We just talked about them. Now what's important is to know the other type of receptors, which called proprioceptors. These receptors are responsible to give information about the position and movement of the mandible and associated oral structures to the brain. And they are primarily found in the musculoskeletal structures. So in the muscles. Okay, so these receptors found in the muscle of mastication mainly, or the area around the mouth, and they tell the brain about the movements and the positions. Okay, these are very important to know because a lot of our work depends on having proprioception. Here's a diagram showing how all what we talked about connects. So in the skin, the vessels, the muscles, we have different types of proprioceptors, exeroceptors, and all of them give signals to the afferent neurons, which go to the spinal cord, where it meets the ganglion. And then in the spinal cords, some orders comes from the spinal cord or from the brain through the spinal cords to the afferent neuron, where it goes and it gives the order to the muscle, so the muscle will contract. And as you know, if we have the receptors and the neurons or the nerve fibers alone, we will be not able to have any movements or any of that would be, none of that would be really useful to us if we don't have the brain or the brainstem. Okay, so the brain and the brainstem are responsible to interpret all the signals that comes, and then they will decide what to do, and they give new orders through the neurons to the muscles in all our body. Now, the second part of this lecture is we'll be talking about the muscles. As you know, if we have a skull without muscles, what do you think will happen? Most probably the skull will fall forward. Why is that? Because it's heavier, and if you notice as it is in the diagram, as it shows, the skull is not centered 100% on our body. Okay, it's a little bit forward. So if we don't have muscles to hold and stabilize the head in its position, the head or the skull will lean forward. So muscles are very important to hold the skull in its balanced position. Now, the motor unit by itself can carry out only one action, which is contraction or shortening. And when we say motor unit, we mean by that the fiber and the nerve attached to it. Now, on the other hand, the entire muscle has three potential functions. Okay, the first function of the muscle is what we call it isotonic contraction, which means the all the or a large number of motor units in the muscles are stimulated. So many motor units in the muscle stimulated at the same time. Contraction or shortening happen. This contraction will make shortening of the entire muscle. And this type of contractions occur in the masseter muscle when the mandible is elevated, forcing the teeth through a palate of food. So when we chew and we are trying to close our mouth, the masseter has to contract and get shorter so the mandible can elevate. Okay, now this action happens when the entire muscle is shortened, and this type of contraction we call it isotonic contraction. The second type of contraction is called isometric contraction. Now, when that happens, this happens when we want to hold something between our teeth, okay? So try to hold a pen between your teeth and feel the muscle, the masseter muscle. It's not very short, but it's not relaxed either. So what happens here, what happened is a number of the motor units in the muscle is activated and they are in a contraction mode, but they are not shortened. So it's like tensed. They are contracted, not shortened, to hold something in a place. Okay, so this is what we call isometric contraction. Now, the third part of contraction is controlled relaxation. And this happens when the simulation of the motor unit is discontinued. So there's no impulse coming to the motor units anymore. The fibers of the motor unit relax and return to their normal length. And this type of controlled relaxation is observed in the masseter when the mouth opens to accept a new bolus of food during mastication. Try to open your mouth and feel the masseter muscle. The masseter muscle will be relaxed, so the mandible can drop. Otherwise, the mandible won't drop. Okay, so these are the three type of contractions happens in the muscle of mastication. And without understanding all the three contraction types, you won't be able to understand how this system operates. Now, in the masticatory system, we have a special type of receptors that we have to know. If you remember, we mentioned that there is a receptor type called proprioceptors. So we had four different proprioceptors available in the masticatory system. The first one is the muscle spindles, and they are specialized receptor organs found in the muscle tissues, and they monitor the length of the muscle. The second ones are the Golgi tendon organs, and you can find them in tendons, and they monitor tension. The third one is the Bassinian corpuscles. They are located in tendons, joints, periosteum, fascia, and subcutaneous tissue, and they work on perception of movement and firm pressure. The last ones are the nociceptors, and they are generally found almost all over the masticatory system, and they work along with the proprioceptors. With other proprioceptors, they work primarily to monitor the condition and position and movement of the tissues in the masticatory system. Now, after we know the components of the masticatory systems, it's time to know what are the functions and how these functions happen. So the first function of the masticatory system is mastication, then swallowing and speech. And all of these functional movements are highly coordinated by the complex neuromuscular events and complex neuromuscular system that we have in our body. So when you eat your food, sensory inputs come from the oral cavity to the brain through the neurons, and then the brain gives signals to these neurons again. They go back to the muscles, they give them the actions, like open your mouth, close your mouth. So there's a lot of coordinations going on here, and mastication, speech, and swallowing is not only muscle of like mastication, we are talking about teeth involved, lips, tongues, cheek, palate, and periodontal ligaments. Now, for example, mastication, it's a function that requires all the structures in the oral cavity to work together to make this function happen successfully. And mastication is involuntary or automatic um, movement, because when you start chewing something, you are not thinking step by step how you're going to chew it, okay? It just happened. That's why it's automatic. And we call it practically involuntary, not absolutely involuntary, because when you really want to stop it, you can. So when you want to stop chewing, you are bringing the swallowing, the mastication into voluntary control. You're moving it from the involuntary or automatic control to the voluntary control. Is that clear? Now, this is a diagram showing the movement of mastication and how complex it is. So it's not a pure open and close. It includes opening, closing, deviation to the side, and then returning to the center again. And it has some backward and forward movement into it. So it's complex. Now, many studies were done to determine what is the maximum biting force that the teeth, that the muscles can apply on the teeth. And actually, it varies from studies to another. And but generally, we can say that we know for sure that for females, the maximum biting force is less than a male, and the average is for a female, it's from 35 to 44 or 45 kilograms, whereas for a male, it's almost 54 to 64 kilograms. It's a lot of force. If you imagine a 64 kilogram force, like falling down on your feet, it's gonna be painful. So this is the amount of force that the teeth should tolerate. Now, and if we think where the greatest amount of force happen in our oral cavity or on the teeth, which teeth are getting the most of this force, it's usually the first molar region. Okay, and if you think, try to choose something, you're gonna put it in the back and start chewing it. And if you think where are you chewing, it's usually the first molar area. And sometimes if you're chewing something hard, so it will be mainly on the second premolar and first molar area. And you will see in your patients that usually the teeth that get cracked or they fracture very frequently are the mandibular first molar, because they are getting a lot of force from the mastication. Now, the second function of the masticatory system is swallowing, and you can imagine how swallowing is a complex procedure. So it's actually a series of coordinated muscle contractions that moves the pulse of a food from the oral cavity through the esophagus to the stomach. And it consists of involuntary, voluntary, and reflex muscle activity. So it's not only voluntary thing. It's not like I want to swallow something, so I swallow it. Sometimes you swallow things and you don't want to. That's because it's involuntary or reflex activity. Now, during swallowings, you all know that the lips are closed. Maybe you notice if your lips are not closed, you can't swallow something. You can't swallow actually nothing. And why is that? Because we need the seal, okay? So we need to seal the oral cavity so the pulse can go backward. And the teeth comes into contact, into maximum intercuspation. Now the mandible, when we swallow, should be stabilized, okay? Should not move. So the suprahyoid and infrahyoid muscle will control the hyoid bone, so the swallowing happens smoothly. Okay, so the mandible during swallowing is fixed, the teeth are in contact, and the lips are tight sealed or tight closed. Now, the last function we'll be talking about today is speech. If you are thinking, if you try to think how we speak, so it starts actually from the controlled contraction and relaxation of the vocal cords or bands in the larynx. This will create a sound with a desired pitch. Now, once the pitch is produced, it comes into the oral cavity, the mouth. So the mouth will determine the resonance and the exact articulation of the sound. So when we say ta or tha or ha, it all started from a pitch from the larynx, and then the mouth articulated to the desired sound that we want. And now, because speech is created by the release of air from the lungs, so we are releasing air, it only happens when we are doing expiration stage of the inspiration. It doesn't happen when we are taking our breath inside. Okay, the air has to go outside so we can speak. So it happens only in the expiration stage of the respiration. This is an interesting diagram that you really need for any smile makeover or any aesthetic case that you are planning to change the position of the teeth or the incisors, because changing the position of the incisors will affect the speech, and if you don't know it, you can ruin it. Okay, so it's very important to know that the M, P, and B sound are created by the lips. The lips come in contact, and then how these letters are pronounced. If you see the S sound, if you try to pronounce it, you will feel that the lower incisors comes very close to the upper incisors, but they don't touch. Now, if they don't touch and you made them touch by your restoration, then you destroy the S sound for this patient. Then if you look at the F and B sound, when we create these sounds, what happens actually is the incisor edges of the upper anterior touch the lower lip. Now, if you move them in a way that they're not touching anymore, then the patient will have difficulty in pronouncing the F and B sound. And for the th sound, if you are doing a complete denture and you made the palate too thick, that the patient cannot really pronounce the th correctly, then you should know that there's something wrong in the design of your restoration that made the patient unable to pronounce this sound. So be careful when you are designing your restorations, when you are putting the incisor edges positions facial-lingually or occlusogingivally. It affects how the patient can pronounce these sounds. Now, for sure, if we are talking about masticatory system, we cannot neglect the temporomandibular joints, which is one of the basic structures that control the movements of the mandible. And now, if you think about it as a system with many multiple factors involved, if a fight would happen between the muscles and the teeth will always lose. Why is that? Because remember, the bite of mastication, it can reach up to 65 kilogram for a male. So how this poor tooth will tolerate all of that? So a balance should happen between the muscles, the joints, and the teeth to be able to function properly without cracking or fracturing the teeth. And these pictures show how if an imbalance happen in masticatory system, how the teeth lose. They crack, they fracture, they wear down, um, the muscles will not get affected, neither the TMJ. Sometimes they might have some pain, some discomfort, but the first signs that you will see usually is on the teeth by cracking or fracturing. And now the temporomandibular joint by itself, so what is it? The skull has a socket where the TMJ is, and this socket needs something into it so we can move the mandible. So if we're adding a lever arm with a fulcrum, that's what's actually TMJ. It's almost like a fulcrum to move the mandible. And now we need to limit the movement of the jaw because it cannot move 360 degree. We have structures that we should protect. So what limits the movement of the TMJ are the ligaments. And you know the anatomy of the TMJ, or you will take it in more details in other lectures, but we all know that there is a disc in this ligament, and this disc is actually attached with there's a disc and the temporomandibular joint itself, and this disc is stabilized by ligaments which attach it so it cannot be, it has controlled movement. And the disc and the ligaments with the bone surfaces involved in this hinge or in this joint, all of them are enclosed in a capsule. So the TMJ composed of a capsule, a disc, and ligaments with the condylar neck, which is a part of the mandible, and the socket is part of the skull. So now we have a temporomandibular joint and a mandible. Okay, these by themselves won't move until we add the muscle to them. So now the muscle of mastication is added to the pictures. So now we can start moving the mandible. And last thing we'll fit in this design is the teeth. So everything is created before the teeth. The teeth comes the last. Okay, so everything has to be coordinated before the teeth comes in. And you all know the muscle of mastication from the anatomy course. Now we'll be talking about the movements that happen because of these muscles. So the first movement is depression of the mandible. So which muscle is responsible for that? It's the lateral pterygoid. And then elevation of the mandible is what masseter, temporalis, and medial pterygoid do. For protrusion, both of the lateral and medial pterygoid will work together to protrude the mandible, while for retraction, the posterior fibers of the temporalis will step in. Now, for side-to-side lateral movement, we need lateral and medial pterygoid to work together. So the left lateral pterygoid with the right medial pterygoid turns the chin to left side and vice versa. Try to move your chin to the left side. Okay, so once you move it to the left side, we call the left side is a working side. And how that happens, the left lateral pterygoid contract and the right medial pterygoid contract. This contraction moves the mandible to the left side. And now for the type of movements that the jaw can do, we have voluntary, reflex, and rhythmic. Okay, voluntary movements, it's something that you think about or something you think you want to do and then you do it. For example, speaking, moving the jaw forward, playing piano is voluntary movement as well. Okay, reflex movements happen without your intention. So for example, the jaw jerk reflex, the jaw opening reflex, the knee jerk reflex, all of these are types of reflexes happen in our body. The last movement the jaw will do is the rhythmic movements, which means you are doing it, you don't think how you are doing it step by step. It's like you are programmed to do it. But if you want to stop it, you can stop it. So that's why we call it the rhythmic movement, like chewing. And it's the same when you run or when you walk. So you start walking, but you're not really thinking of every step you're doing. Your body is programmed to walk or programmed to run. And if you want to stop it, you can stop it. So these are the main three movements that we should know: voluntary, reflex, and rhythmic. These are the movements that happen in our masticatory system. So that was all what I want every student to know. This will facilitate for you to understand the rest of this course. Occlusion is, some people will feel it's dry, it's something difficult to digest or swallow, but honestly, if you really understand it, it's easy, it's nothing complicated, and it's logic. So the reference for this lecture is this chapter from this textbook. Please go and read and see the photographs and the diagrams. They really help. And let me know if you have any question. You can email me with any question you have. So that's all, and thank you for listening. And hopefully I will see every one of you one day either in the lab or in the clinic. Have fun.